Hello everyone, my name is Dr. Rohan Reddy. I am a consultant gastroenterologist, hepatologist and therapeutic endoscopist here at KIMS Sunshine Hospital at Secunderabad. So I'm going to talk a few things about intermittent fasting. So intermittent fasting has been the latest fad the last couple of years, where we hear a lot of people talk about this form of dietary management and weight management, where people fast for a couple of hours. When it comes to intermittent fasting, there are basically two types of intermittent fasting. So one is a time restricted feeding, and the other one is alternate day fasting. The most commonly practiced time restricted feeding is 16:8, where 16 hours we ask patients to be on a fasting state, and the rest 8 hours is where they have a eating window where they can eat a normal diet or a calorie restricted diet based on their energy needs. So the other form of intermittent fasting is alternate day fast. Alternate day fasting is done where one day patients are not eating anything, or there is a little bit of a low restricted calorie intake which the patients can have. And the other day where they can have a normal diet or a calorie restricted diet, the other day when they are not fasting. So these are the most commonly advised intermittent fastings. What intermittent fasting does is, when we are fasting for 16 hours in a day, there is no glucose that is absorbed from the intestines. So the body looks for an alternative source of energy. So the alternative source of energy is mainly from three things. That is your liver, your fat or the adipose tissue, and the muscle. So these three things are the major energy stores of our body. But because the body is depending upon these sources, so there is increased amount of lipolysis, or fat is getting converted into glucose. That is how patients after a period of time start losing weight. So does it actually work? Yes, there are plenty of studies which were done in humans, and also a lot of animal studies which were done, which showed significant improvement in weight management and also glucose metabolism with intermittent fasting. So what are the advantages with it? One basic advantage is that you lose weight. Second thing is there's improved amount of better glucose control in their bodies. Increased exercise performance. So it is seen in especially in younger age group. Studies have showed them to have better physical control, better energy capacity. There is increased amount of cardiac advantages with intermittent fasting also, where it decreases your resting heart rate. So is everyone a suitable candidate for intermittent fasting? Then I would say probably not. So you need to consult a doctor before whether you can start intermittent fasting or not. What are the disadvantages with intermittent fasting? So the major disadvantage with intermittent fasting is, see, these patients do come back to us with a lot of gastric issues. What happens is, if you're not eating anything for 16 hours, there's a lot of reflux that happens in these patients. So reflux is one thing that patients significantly complain of, and other gastric problems, and some patients do complain about constipation and all of these lifestyle disorders. That very important whenever you're starting intermittent fasting, to do it the right way, to have professional help from the start, and to balance it out, not do it very vigorously, and to always balance it properly. That is how you do intermittent fasting.